Welcome back to West Texas View.
We left at the break with Dr. Jain talking about how a student comes in and chooses what kind of specialty area that they're working toward when they get to that point. And you said it was a little bit difficult to get people to go into psychiatry as a first profession, but that every one of the medical students knows a little bit, and explain to how that happens.
So as part of the third-year clerkship, as we call it, they are exposed to
all students.
All students are required to go through rotation, as we call it, 8 weeks rotation. In our excuse me, in our curriculum, they're required to go to 8 weeks rotation through different specialties. The main specialties that are required, what we call the core rotations required before they can move on to the higher levels of training. And that may include psychiatry, medicine, surgery, OBGYN, pediatrics, those, and of course you have OBGYN, pediatrics, surgery, and 6 of them are there.
Internal medicine.
And internal medicine, of course. So these are the rotations they have to go through 8 weeks, and psychiatry seems to be one of the core rotations there. So when they become doctors, they will
know a little bit
about psychiatry. But what I've seen that in certain specialties like OBGYN or family practice or even pediatrics, they tend to see more psychiatric patients than we do, because most people are comfortable talking. Women are more comfortable talking to their OBGYN or their primary care physicians. Men are more comfortable talking about their internist or their family practice doctors about if they have any psychiatric problems. So it's not uncommon for me to get significant amount of my clientele from as a referral from other doctors. But it does not mean that folks cannot approach to us directly. What we tend to do is, once we tend to rule out medical problems or medical reasons that can address psychiatric issues, we rule them out first by doing lab investigations or other investigations. Then we regard that as a psychiatric issues. So yes, either that can be done at a primary care level or can be done by us. But most insurances now do allow folks
to come directly
to see a psychiatrist.
And one of the things that I know in the past I've heard is that when a like a heart patient is going to their regular doctor, many times the doctor is so busy that he doesn't think to find out if there's any kind of chronic depression. And that has such a correlation, and that people with heart failure, for example, will die quicker if their depression isn't treated. And so it's really a dual treatment that's needed.
It's a mind-body. I'm glad you brought that point up, because it directly links to the study I wanted to talk to you about, the correlation, that's the association between heart conditions and depression. We have found that this study, which recently came out of Salt Lake, Utah, indicated that up to 30% or 20 to 30% of patients, up to 1/3 of patients, after having any cardiac event, any heart event, tend to have significant depression. And if unrecognized and untreated, they usually have a very protracted or long-term course of heart problems. And vice versa.
And die sooner.
and die, of course. Eventually they die sooner. And it's vice versa. People who have suffered from depression chronically for a long period of time tend to have more heart problems than people who don't have it, be it because of sedentary activity, because they're too depressed, or because of their choices of diet, or because of other neurochemicals that are secreted in the body when you're depressed, that is harmful for your cardiac functioning.
So this needs to be a really good relationship between doctor and patient, and the patient needs to take charge and say, I just feel lethargic, I feel depressed all the time, or I feel unhappy, and bring this up. Don't just give me some statins and medication to treat my heart, but try to help me get through this, or tell me who I can go see.
Right, exactly. Knowledge is power. If you are aware of what's going on in your body, you can actually direct your physician to look into other areas. Because believe it or not, and I'm not saying that your doctor may not be looking into it, but when we are trained to subspecialties like cardiac or even psychiatry, we tend to have one way of looking at things. And very often we tend to overlook other things also.
Or they're so busy with their own specialty,
specialty.
they don't
There are
look
so many
at these
different
other
things that may be going on at the time that it's maybe difficult for them to look into other ways. But that's where the research comes into play. It's designed to make aware people, particularly physicians, that when you're having a cardiac patient and when you're having a depressed patient, we should always look for the other thing, because the patient, the mind and the body are always connected. You cannot separate them. If you're having a body issue, your mind is going to get affected. If you're having a mind issue, your body is going to get affected.
And you know, that's what Viktor Frankl taught, was a human is a three-person unit: mind, body, and spirit. Mind, body, and soul. And so when one's affected, they're all three affected.
Others bound to get affected.
Yeah. And that, so I'm really interested, but I want to get back one more time and just talk about your practice, not your work in the medical school, but your practice. You're working with a group of Texas Tech physicians in a clinic, and so you are more accessible than just a regular psychiatrist that might be on the streets of Dallas or something.
Well, that true. The philosophy is yes, but and that's the whole
maybe
point.
No.
but the problem has become, because there is so limited psychiatry available, and many psychiatrists accept very few insurances. So, but because we are a state institution, we accept most insurances. In fact, every insurance possible, including Medicaid. So we get number of patients. So I'm coming to the point there. And that's where we are looking for new psychiatrists. Yes, we are accepting new patients. We are trying to increase our working hours. In fact, I'm working on Saturdays also to accommodate more patients. I can possibly see them. Yes, we are trying to accommodate them. It may not be the most easiest way to get hold of us. That's why we have emails and other contact information. But our philosophy is to accommodate everybody and everybody who walks into our door. Our setup is like that we have on the same floor internal medicine, we have same floor family practice, so that if I had any medical question, I can just walk around the aisle and ask questions on there, or get walk the patient around the aisle and address their medical needs, and vice versa. So the whole setup has been with the idea that patient does not just have psychiatric issues or internal medicine.
It's a continuum care.
It's a collaborative care that patients need to address.
We're going to have to take a break. We'll be back and finish this conversation in just a minute. Join us then.
Stay tuned. West Texas View will be right back.